My name is Shirley Morgan, and this is my care coordination presentation to colleagues for NUR-FPX 4050. Hello everyone, I am Shirley Morgan, a registered nurse in a cardiac step-down unit. Today we will discuss care coordination and how this affects patients' overall outcomes. Care coordination is the organization of patient care among all healthcare professionals, sharing information about the patient's treatment and goals. Utilizing care coordination allows us to achieve better outcomes and ensures patients receive the necessary care. In this presentation, we will discuss effective strategies for collaborating with patients and families on creating desired outcomes, what change management is and how it affects patients, why we use care coordination in ethical situations, and discuss nurses' vital role in the coordination and continuum of care. When patients are actively involved in their care, healthcare professionals, patients, and their families form a partnership. This partnership increases the chances of better outcomes and greater satisfaction with the care patients receive. We must create and maintain an environment where patients feel welcome to participate in their care. The purpose of collaborating is to partner with patients in creating and reviewing documents like informational handouts and videos and planning programs for patients. Anderson et al. 2021. We can foster effective collaboration by holding monthly project meetings, allowing us to collaborate with our patients and establish their next treatment goals. Adding more patient advisors to our interdisciplinary team is a great way to bridge the gap between patients and healthcare providers. If the patient family can't convey their wishes, patient advisors can offer insight. Over time, patient advisors contribute to multiple improvement activities. In addition, we enhance patient involvement, offering better satisfaction and improved patient outcomes. Change management enables healthcare organizations to transition to a desired state. Change is inevitable in healthcare, and we must create an environment where patient safety is the highest priority. Change management directly affects how patients benefit from healthcare services. Lippitt's change theory outlines the necessity for organizations to recognize the need for change, define the change problem, establish action plans for achieving change, implement the change, and redefine the relationship between the change agent and the system. Barrow and Armagini, 2022. Once a change has occurred, we must ensure our staff is adequately educated about the change to guarantee there is no impact on patient care. The organization and staff members must foster open communication about the change, educating them on new policies and procedures. Without this, we risk the chance of patients not knowing, which decreases satisfaction. If the organization had issues with multiple family members staying past allotted visiting hours and implemented a new two-person visitation rule, we must ensure the organization creates a way for everyone to be informed about this. If the patients and family are unknowing and are asked to leave, we create an environment where they do not feel welcome to participate in their care. In healthcare, we treat many patients with different cultural and ethical backgrounds. As professionals, we must consider this when caring for patients. Care coordination is based on ethical decision-making as we address our patients' preferences and ensure we maintain their autonomy and trust. Healthcare professionals must recognize dilemmas and make correct judgments, considering the patient's ethical preferences. Hadid and Greger, 2023. As nurses, we spend the most time with our patients during their inpatient stay. I have often been asked, what would you do? Patients feel more vulnerable during this time of illness and often look for insight regarding their care. This is why ethical decision-making is crucial in care coordination. Patients have their own wishes for their care, which is occasionally different from the expectations set by the patient's team. As professionals, we must remain unbiased and just educate them on the treatment offered to them and the reality that may occur if they decide not to follow their treatment plan. The patient is always the highest priority, and we must allow the patient to be included into their care. Healthcare policies can affect patients' care options. The Affordable Care Act was created in 2010 to offer affordable health insurance to more individuals. Affordable Care Act, 2024. The Affordable Care Act expanded Medicaid coverage for millions of Americans, allowing more people to receive health care benefits. It also prevented insurance companies from denying coverage if they already have pre-existing conditions. With the enactment of the Affordable Care Act, many Americans have been able to receive treatment for conditions that they would have previously not been able to afford. With more people seeking care and treatment, healthcare often becomes overpopulated. It is now treating conditions that have not previously been treated, which can cause other comorbidities to occur. By increasing the number of people receiving care, we can now prevent bad outcomes in more patients, offering better outcomes and higher satisfaction among our patients. Nurses are essential in healthcare, especially in coordination care with patients. Working on a cardiac step-down unit in a rural area, I care for patients who have low health literacy and often do not understand what is being discussed when the cardiologist discusses their care. I must educate the patients on what is advised and listen to their needs and preferences so I can communicate with their doctors. Being educated on the patient's care plan and assessing their progress is essential to producing good outcomes for my patients. I must educate the patient at discharge on the recommended follow-ups and medications that they will go home with and assess where they may need more educational time before they go home. Doing this care coordination is continued all the way through up until discharge and can ultimately decrease the recurrence of readmissions to the hospital. Today, we have discussed care coordination and its effects on patient care and outcomes. We have also discussed how to achieve effective collaboration through active patient involvement, change management theories and how they affect care coordination, change policies like the Affordable Care Act, ethical considerations in care coordination, and the nurse's role in the continuum of care coordination. I hope this presentation has given you a better understanding of care coordination and its importance for patient care and overall outcomes. Thank you.